My name is Pilar Suguimoto. I am affiliated with the Center of Medical Education and also a member of the Department of Global Health and Social Epidemiology here at the School of Public Health. So today I'm going to talk about infectious disease epidemiology in the world. I understand that last week Associate Professor Tirani, she talked about infectious disease through human history. So today would be a little bit, I will take over from maybe the last part of her talk. I hope it's okay. I suffer from a little of allergy, so if I start coughing, I apologize beforehand. So let's first see a little overview. Worldwide, it's estimated that in 2012, there were 56 million people who died. And from this number, most of them were due to non-communicable diseases, 68%. But a significant proportion of these deaths were also due to communicable diseases, maternal, neonatal, and nutritional conditions. If we look a little further into this number, 17% of them are only attributed to infectious and parasitic diseases. 9% of deaths were due to injuries. But out of these significant proportion, the distribution among the countries is actually very disproportionate. In low-income countries, 38% of the deaths are from infectious and parasitic diseases. So this tells us about how relevant it is to study and talk about infectious diseases, especially in the global context. If we see here the top 10 causes of death for the year 2012, to your left, you can see the global. In a global scale, most of the causes are non-communicable diseases. And although the disease patterns changes constantly, communicable diseases remain a leading cause of mortality and morbidity, especially in less developed countries or in low-income countries. You can see here highlighted in red. To your right, the column to your right shows you the leading causes for low-income countries. So you can see how the top 10 causes are communicable diseases, low respiratory infections, HIV/AIDS, diarrheal diseases, and malaria and tuberculosis. But if we group the countries, if we see them through the WHO region distribution, we will see in this graph, for instance, how much of the burden is faced by different regions in the world. If you see here to your left, the first two columns, this is crude rate by cause of groups. From the year 2000, we're comparing to the year 2012. So if you see here, the first one, here is, for instance, year 2000 for the WHO region of Africa. We compare these to the year 2012. Okay, this is for the region of Africa, Americas, Southeast Asia, Europe, Eastern Mediterranean, and Western Pacific. If you see with the colors, the light blue will be communicable, maternal, neonatal, and nutritional conditions. So you can see here how much disparity there is between these regions, and especially in the WHO African region. Despite some positive changes that you can see here from the year 2000 to year 2012, the decline of communicable maternal, neonatal, and nutritional conditions, they are still bearing much of the, they are still facing much of the burden, globally speaking. So I don't know if you are familiar with this measure, the DALYs. Has anybody ever heard about DALYs? Can you raise your hand? Yes? Okay, so it's good, it's not unfamiliar. For those of you who haven't heard about this, I'll quickly just mention what it means, okay? This is actually a measurement. You know that the burden of the disease, you can see it through incidence, through prevalence, mortality. But we also have this other measure called DALY, okay? The World Bank, WHO, and the Harvard School of Public Health started this big project called the Global Burden of Disease in the late 80s. And they developed this measure that stands for Disability Adjusted Life Years. Okay, this is a measure of the overall disease burden, and it's expressed in cumulative number of years lost due to ill health, lost to disability, or to early death, to premature death, okay? If we see here the graph, when we are born, generally we're healthy, and you have a certain life expectancy for specific countries. So you're expected to live until this moment, right? But during the course of your life, you will be sick, you will be ill, you will have a disease. And for that, you may have, sometimes you will be ill, then you will recover your health, you may be ill again. Or maybe at the end of your life, you can suffer from a disease severely impairing your life. Or maybe you will die prematurely, meaning you will die before the life expectancy for the country. Okay, so if we sum all these years that we lost because we were not in healthy condition or because we died prematurely, we'll have a measure called DALY. Okay, and we can use DALY actually to compare diseases that, for instance, may just kill you compared to those that, instead of killing you, will give you disability or ill health during a number of years, okay? This is to measure different burdens of diseases. So in 2012, the total global burden of disease was more than 2,744 million DALYs, okay? Out of these, 21% was due to communicable diseases, all communicable diseases. So infectious diseases will account for 21% of the DALYs, which will reflect the number of healthy years lost to an illness. Then we have different conditions here if you see the figure. And HIV, you will review it next class with Professor Kihara. Today I will talk a little about malaria, tuberculosis, and other infectious diseases. But first, let's see some key terms so that we speak the same language and that we understand each other. These are very basic terms that we will be using throughout the class and most probably throughout the course. So I like to make sure that we all understand the same thing. Incidence, for instance, the measure of the number of new cases, okay? New cases of a characteristic, such as an illness or a risk factor, that will arise in a population on a given period of time. We have also incidence rate. We will mention the incidence rate, which is a measure of frequency with which a disease will occur in a population over a period of time, and typically it will be expressed as number of cases per person, year of observation. Okay? And then we have prevalence. Okay? Prevalence will refer to the total number of individuals in a population who have a disease or a health condition at a specific period of time. Now, two other key terms that you may have already heard of last week with Associate Professor Tirani was emerging disease. Do you remember this, right? Emerging disease are those diseases that have not occurred in humans before, or they have occurred previously, but affected only small numbers of people in isolated places. Okay? Or they have occurred throughout human history, but have only recently been recognized as a distinct disease due to an infectious agent. And then we have also re-emerging diseases. These are diseases that once were a major public health concern, or globally or in a particular country, and then they decline dramatically. But they are again becoming health problems for a significant proportion of the population, such is the case of malaria and tuberculosis. And this is why I'd like to touch on these two diseases. This figure is taken from a paper from the authors Morens, and the title is The Challenge of Emerging and Re-Emerging Infectious Diseases, published in Nature, if you want to read a little more about these. But this is just for you to see how many emerging diseases we have been having throughout the time. The red ones represent the newly emerging diseases. Okay? The blue ones are re-emerging or resurging diseases, and the black ones are deliberately emerging diseases, none other than bioterrorisms. Okay, so in the whole world, we do have different diseases emerging in different places. Now, the most salient modern example maybe of an emerging infectious disease is HIV/AIDS, which by now we know that very likely emerged a century ago, and after multiple independent events, the virus jumped from a primate host to another and then subsequently spread readily within the human population. But you will learn more about these next week.